one of the ways that they do in cut-rate labiaplasties is you send the money a month in advance, you come in the day of procedure, and you go in the exam room with your clothes off, ready to do the procedure without so much as trying to get a history. She needs to be done before surgery is performed if you're going to look to get a consistent, good result. And to get the 95+% satisfaction rate that I've gotten over 7 years, it's because I haven't skimped on doing all of those pre-op, intra-op, and post-op things that need to be done. The reality of this is results, results, results. From the beginning, I saw horrible, and I've got books full of, as I call them, disasters. And I set out to develop a technique, which we've now called the stem iris labia sculpturing, that would, in the greatest amount of people, give the absolute best results with the least complications and be reproducible. So whether it's inverse wedge technique, whether it's a pedicle flap technique, whether it's a laser technique, the bottom line is, what does it look like 6 months from now? My labiaplasty 6 months from now look like the people were born that way. The women look like they were born that way. They love my results. We do 3 sets of computer digitalized imaging so that the patient really gets a good idea of what I can accomplish. As opposed to somebody coming in, or some doctors let them come in bringing a magazine, and I want to look like this. Well, guess what? This is an Andre Agassi look, but I'm no Andre Agassi. So given what I have, when someone comes into me after the interview, after the physical exam, we then shoot digital images. We immediately come in and blow it up either on an HD computer or a large screen, and I show them what I can accomplish for them. Then we do computer digital imaging to create what I call a future final aesthetic. And that's what I think 6 months from now, this is what this is going to look like, given all the variables, because this is surgery. It's an art form, it's not a science. Can't guarantee it, but 95% of the time, my patients are happy. And from continually refining and improving my technique, my results were the best in the beginning, but now 7 years later and 1,000 cases later, everybody wants my results.